Welcome back to Drugs and Behavior with Dr. Goodin. Next, we'll be talking about Chapter 12 Performance Enhancing Drugs and Drug Testing in Sports. There's a picture of Lance Armstrong. He's used some drugs. Use of performance enhancing drugs is a concern not only among athletes that are in the public eye, but also among a growing number of young people who simply want to look better by developing their muscles. Greek athletes in the Olympic Games of ancient Greece used hallucinogenic mushrooms to improve their performance or to achieve some kind of mystical connection to the gods. Later, Roman gladiators and charioteers used stimulants to sustain themselves longer during competition, even when injured. By the end of the 19th century, world-class athletes were experimenting with a variety of stimulants and other drugs, including cocaine, caffeine, alcohol, nitroglycerin, opioids, strychnine, and amphetamines. In the 1930s, the advent of the anabolic steroid drug was specifically patterned after the male sex hormone testosterone to actually alter the structure of the athlete's body. Anabolic steroid use had previously been used and studied for the treatment of anemia and for conditions that cause muscles to waste away. Ergogenic changes refer to performance-enhancing changes. Testosterone has two primary effects on the human body. Androgenic, meaning man-producing, in that it promotes the development of male sex characteristics, an enlarged larynx, resulting in a deeper voice, body hair, and an increase in body size, as well as general changes that make them sexually mature adults. Secondary effects involve anabolic or upward changing effects in that it promotes the development of protein and as a result an increase in muscle tissue. Muscles in men are inherently larger than muscles in women because of the anabolic action of testosterone in the male body. With the development of performance-enhancing drugs, the goal is to emphasize the anabolic function while retaining as little of the androgenic function as possible. These are different from adrenocortical steroids, which are used medically to treat tissue inflammation. Steroids have been used openly in Olympic Games until recent years. Female athletes who use steroids have developed masculine features. The 2000 Olympic Games in Sydney instituted strict drug testing procedures and a commitment to an oath to not dope or use drugs. In 2000, the World Anti-Doping Code was created with the agreed-upon list of prohibited performance-enhancing drugs and performance-enhancing methods in international sports competitions, testing procedures for their use, and specific penalties for violations. This has been used in the NBA and the NHL, for instance, and is updated with the availability and development of new drugs. Lance Armstrong was found to have used performance-enhancing drugs and was banned for life from cycling and stripped of his 7 Tour de France titles, as well as his bronze medal from the 2000 Olympic Games. In the 70s and 80s, 50 to 90% of NFL players were on anabolic steroids. Many athletes begin to use steroids as college students or high school students in almost every sport. Barry Bonds brought attention to the Major League Baseball use of performance-enhancing drugs and brought the MLB into regulations similar to the NFL and NBA. In lieu of performance-enhancing drugs that were steroids, non-steroid types such as human growth hormone have been used instead. A bodybuilder on anabolic steroids takes 5 to 29 times the therapeutic doses recommended for the medical use of these drugs, and in some occasions has reached 100 to 1,000 times the recommended therapeutic dose. They upset the balance of hormones and other chemicals that are normally controlled by testosterone. The testes produce less testosterone by being given the message that their services are no longer needed. The testicles shrink, and lower sperm count leads to sterility. The male breasts enlarge because steroids break down eventually into estradiol, the female sex hormone. Other consequences include frequent, sustained, and often painful penile erections, a condition called priapism, and an enlargement of the prostate gland, severe acne, increased facial hair growth, and accelerated balding. Some athletes try to counter these undesirable hormone effects with the use of HCG, a hormone that ordinarily stimulates the testes to secrete testosterone. HCG itself may cause headaches, mood swings, depression, and fluid retention. For women, many physiological changes may take place and are often unreversible. Use may result in the development of liver tumors, high blood pressure, high cholesterol levels, heart abnormalities, increased risk of cardiovascular disease, and heart-related sudden death. Mood swings and increased aggressiveness may be referred to as roid rage, evidence that there may be real psychological changes occurring. Testosterone significantly increases manic behavior and feelings of aggressiveness. The effects vary tremendously by person. Anabolic steroid use during puberty and teenage years enhances muscular development but stunts growth. For girls, testosterone-related drugs delay the onset of puberty, making the body shorter, lighter, and more girl-like, while enhancing the user's overall strengths. Anabolic steroids may result in psychological levels changing, feelings of euphoria and aggression, loss of confidence, lethargy, depression, all of these when the drugs are discontinued. In 1990, anabolic steroids were reclassified as Schedule III controlled substances and transferred from the FDA to the DEA jurisdiction. Steroid distribution is an anonymous black market enterprise, and using is often referred to as being on the juice. They are transferred through bodybuilding gyms and internet websites. Drugs are smuggled in the U.S. from Europe, Canada, and Mexico, resulting in a market of $3 to $4 million per year. About 2% of 8th graders, 10th graders, and high school seniors had used anabolic steroids in their lifetime. Anabolic steroids can be taken orally or through intramuscular injections, or by using a combination of both types called stacking. Injections using large needles leave scars and may result in HIV if shared. Cycling is common in drug usage of this type, with steroids being used for 4 to 18 weeks, followed by a period of abstinence. Newly developed muscles shrink when the drug is withdrawn, encouraging a return to usage. A technique called pyramiding is the use of more and more steroids prior to competition and then dropping off before the competition to avoid detection, resulting in withdrawal effects during the competition. Steroid abuse may result in a kind of reverse anorexia that has been called muscle dysmorphia, a belief that one's physique will forever be imperfect. The ideal masculine body type has become as unrealistic as the Barbie doll for women. Prevention programs have helped reduce the amount of use of anabolic steroids. Many counterfeit steroids have emerged. An illegal or illicit alternative is human growth hormone, which is more popular due to wider availability and cost effectiveness. Use of HGH increases the risk of developing a side effect called acromegaly, a condition resulting in a coarse and misshapen head, enlarged hands and feet, and damage to various internal organs. HGH increases lean body mass, but the increase both does not raise levels of strength or endurance. It results in fatigue, joint pain, carpal tunnel syndrome, and has not been shown to enhance performance. There are many dietary supplement products that claim to enhance performance. Many are testosterone related, but are not considered anabolic steroids. The Anabolic Steroid Control Act of 2004 expanded the Schedule III classification to precursors of testosterone, such as andro. Creatine has been found to enhance the retention of water in muscle cells, causing them to expand in size. Little is known about the long-term effects of many of the supplements because they are new and unregulated. Amphetamines were used in sports until 2005 when they were banned, but ADHD drugs are still available and do not violate the ban. Many athletes still use the drugs with the plan on tricking or sidestepping drug testing. Drug testing in the NCAA also tests for non-performance enhancing drugs. Drug testing begins with a urine sample which is divided into 2 samples before being sent to the laboratory, so that if one sample yields a positive outcome, it can be retested for verification. Urine testing may also be used through a GCMS method, in which urine is vaporized and combined with an inert gas passed over chemically treated columns that change color. It is more expensive and time-consuming, but it is the only procedure that adequately screens for anabolic steroids. There is also oral fluid testing, in which a collection pad is placed between the lower cheek and gum for 2 to 5 minutes and later sealed to be analyzed. Embarrassment by the donor is a consideration. Drug testing is interested in the sensitivity of the test and the specificity of the test. 2 tactics employed to disguise the prior use of anabolic steroids during the drug test are no longer used because organizations test for them. Drug testing is expensive and does not necessarily pinpoint the time of drug use. Drug testing in high schools does not seem to be a deterrent. The recent development of an idealized body image among men is part of today's standards for sexuality and social acceptance. Men are increasingly objectified. I will see you in Chapter 13.